In fact, there's hundreds of them. And the tests that you're referring to are these molecular tests or these PCR-based tests that can diagnose somebody as having active infection. It's difficult to answer that question because I don't know exactly which tests you're referring to. What is really important is that the tests that are being used by any governments or being sold, that there's clear results of how well these tests work. There are the possibilities that if they are not validated, we call validated, where we test them against known samples of whether the samples are indeed positive or negative. It's very difficult to know if the test result that you're getting is a true result. And as you've highlighted, there are risks associated with having a false positive in thinking that you are infected and you are indeed not, and more importantly, if you test false negative, where in fact you are infected and the test tells you that you're not. So there are some risks associated with being sold over the counter. Having said that, the ingenuity, the rapid development of these tests is very positive, and we welcome this innovation. We welcome the speed at which these tests are being made available, but it is important that they're validated. It's important that we really understand how well they work. Bottom line, though, is that everyone that is out there needs to adhere to public health measures regardless. These include hand hygiene that the DG has just mentioned, and you've heard us mention well, with washing your hands with soap and water or an alcohol-based rub. Practice physical distancing, so where you're physically distant from another person. Adhering to the public health measures that are put in place by governments. Practicing respiratory etiquette. These are the things that must be adhered to all the time while we work through the use of some of these tests that are coming online.
Thank you very much, Dr. Van Kerkhove. Hope this answers the question from Isabel, and it was on self-testing. Next question is from Joan from Meetings